Hello, and welcome to another episode of the Physician's Guide to Doctoring. I am your host, Dr. Amna Shabbir, and today's guest is Dr. Cynthia Correa-Cedeno. She is an expert podiatrist who practices holistic foot care, and today's episode is all about things we don't think about when we're looking at our patients' feet. So tune in.
Hey, this is Brad Block, host of the Physician's Guide to Doctoring. This is a personal and professional development podcast for physicians where we have experts on the show that try to teach us everything we should have been learning while we were memorizing Krebs cycle.
Hello, and welcome to another episode of the Physician's Guide to Doctoring. I am your host, Dr. Amna Shabbir, and today I have a very special guest. Dr. Cynthia Correa-Cedeno is a board-certified podiatric surgeon with a unique focus on minimally invasive surgery, biomechanics, and holistic foot care. With years of experience performing surgeries in outpatient care, Dr. Correa-Cedeno has years of experience correcting foot deformities, enhancing patient movements through gait analysis, and creating custom orthotics to address specific patient needs. Welcome to the show, Cynthia. How are you today?
Thank you. Thank you for having me. Loved how you pronounced my name. It was wonderful.
I tried. All right. So I first want to know about what drew you to podiatry in specific. What was your inspiration for that?
I've been thinking about that lately a lot. And it was a podiatrist in North Carolina that I shadowed when I was in college. And she is part of the Lumbee tribe, which is a Native American tribe in North Carolina. And she went back to her hometown to help heal her patients. She healed them in the clinic. She healed them in the hospital to reduce the chance of below the knee amputations or foot amputations. And that just sparked a fire inside of me. I had to be a part of that.
Wow. That definitely sounds inspiring. And, you mentioned your interest is holistic foot care. You're practicing in a very unique way. I want to learn a little bit more about that.
Yes. So I'm practicing mobile podiatry in Orlando, Florida. So I go to people's home, take care of them. It's been an honor and a privilege to be in such a comfortable environment with that patient and sharing that space with them. And we talk more holistically because although I am, yes, a specialist of the foot and ankle, and my scope of medicine is below the knee, it's all connected to the body. So if your body is optimized, then I can help you with your foot problem, your ankle problem. So I have the time to care for them and ask those specific questions that are pertinent to the patient's health journey for their foot, for their ankle, for their foundation, which are your feet.
As a geriatrician, it makes me very happy to hear that you are bringing those unique services to patients' homes because access, we talk about access to care and barriers to care. One of that definitely is transport, which when we talk about how challenging it is for families to transport loved ones to appointments and back to appointments. So I think it's wonderful that you're bringing those services to the patients' homes. So to share a little bit, you've practiced medicine in the traditional ways. And what are the common mistakes that you have seen in your years of practice that people do when they're, physicians do, patients do? Demystify the feet for us a little bit.
Yes, I think it's when we chase symptoms and focus too much on the symptoms and not the cause. Because I'll have patients come in and they have this extreme pain in their foot. And, we'll get x-rays, we'll do MRIs, we'll do CT scan, everything looks good, but something is going on. And a lot of the times it has been something neurological, more up in the spine, L5, L4, S1 that's connected to the foot. And some patients have compressions there, lumbar radiculopathy. And at that point, I need to refer them out to a neurologist. And they'll do an EMG test and they'll check what's going on with the nerves. I'll still help treat their symptoms at the same time. But finding the root cause, it's more effective for the patient long-term.
Really, that's where kind of that holistic element comes in. Don't just look at what the obvious cause looks like. Think a little deeper, dig a little deeper. And practicing primary care, when I was doing that, it is challenging when there's so much going on and you are in that busy practice. So it's okay to refer to podiatry and to your colleagues, but kind of thinking a little bit deeper. What other common things that have you noticed in your practice?
So also neglecting comprehensive exams. And I know that we're all really rushed, but there's been times that just severe dehydration has led to really bad joint pain, like in the big toe, in the ankle. And I discuss very simple things. I'm like, how much water are you drinking a day? And if there isn't any issues with intake, like anything going on with their kidneys or a heart overload, then I can discuss, hey, it's usually whatever you weigh, divide that by half and drink that in ounces and increase that every week by, I don't know, 5 ounces, something that they could do. And I noticed that their pain gets better because they've optimized their own body. And I talk about simple things like sleep and how much do you move? And that helps with the joints because you're moving the synovial fluid in between the joints. And that's like lotion in between the joints. And I talk about that with my patient, and that helps with their stiffness or their straining with the joints and the muscles in the foot.
Yeah, well, sometimes when we're just like focusing on band-aid solutions, like, do this or medications, and we're really not digging a little bit deeper into what's the cause, like you mentioned, hydration, and explaining this to the patients,
Yes.
like communication, it's
Yes.
huge. It
Yes.
can be very disconcerting when you are going through something and you really don't know why this is happening to you. It's so important to talk about that.
Yes. And another big one that I've given a lot of respect to, nail discoloration. I give it respect now because it's not as straightforward as patients think. And they commonly say, oh, I tried antifungal treatments. I tried antifungal treatment. It doesn't work. Well, because it's not a fungus. Sometimes it's just nail deformities that could be coming from shoes being too tight or too large, especially some of my runners. If they're using the wrong shoes, it keeps bumping into it, causes a problem. Sometimes my roofers has even an issue because the way that they have to walk on the roof and they have to bend over, that's putting a lot of pressure on the big toe. Nail pops off, and that changes the whole DNA and anatomy of that nail. And there are ways to bring it back if you educate the patient properly. So I get excited now whenever a patient says, oh, that antifungal medication didn't work. I'm like, you probably didn't have a fungus, or you didn't treat it the right way, or you were put on medication like oral terbinafine, and they didn't talk about maintenance care because they can come back, especially on my patients that have very sweaty hands. That's going to mix up with the fungus and the bacteria, and it's going to cause a reoccurrence. So even something as simple as I tell my patients, hey, put some deodorant, some spray deodorant on the foot, and now dry it out. And that reduces the chance of that fungus from building up. And that's maintenance care.
That's important to know. And as you kind of like look at settings in which we practice medicine, so we have outpatient settings that are busy when we're churning patients one after the other, trying to remember everything. What kind of like advice would you give to somebody who's practicing in the outpatient setting? You're seeing all these things, like this is probably where mistakes in foot care are happening. What would you kind of wish physicians and other healthcare workers kind of knew what to tell the patients and when to call you?
Well, I want to go back to like the advice that I would give physicians is don't rush. I would do that a lot, rushing. Made a lot of mistakes, but with me to call the patients that have any chronic pain, and chronic pain doesn't mean like 3, 6 months, 15 years, anything that's been going on for longer than 7 to 14 days, and the body hasn't healed it naturally, something is off, whether it be something biomechanical, the patient needs some custom orthotics or some realignments of the joints, or we need to look at what's going on holistically with the body. I'd say, hey, refer it over to us so we can help that patient reduce their pain, optimize their health, so they're not continuing to walk on the same issue that they have.
I see you mentioning holistic care. So I'm just curious to know, when a patient comes to you and they're, for example, having this foot pain concern, we have kind of assessed for underlying causes. We can't really pin down if it's radiculopathy or something else in specific. How do you approach like foot pain in a holistic care setting, and kind of what is your way of doing that?
It does take some time because I ask my patients to do a food log. I ask my patients to do how much water they've been drinking, and we dig in a little deeper. I ask them about their stress and how much they've been sleeping. I examine their shoes. Sometimes their shoes are really worn out, and that's causing an issue there. We talk about, I see them walk, and we talk about their gait. I get x-rays, not so much to see systemic issues, but to see the anatomy of their unique foot type. And then we can discuss, hey, this is the type of shoe that would help you improve the pain that you have right now. Because patients will always ask what shoes to wear, and they think one size fit all, but it isn't. It's up to that individual. Like, do you have wide feet? Do you have narrow feet? Is your big toe longer than your second toe? Is your second toe longer than your big toe? So due to that arch of your foot, it's going to indicate what type of shoe is going to be better for you. I'll see people with wide feet wear narrow shoes. I'm like, well, let's flip that. Take off some pressure from the foot.
That's interesting. I would not have gone to like talking about water and food intake when we're talking about feet. So that definitely is a different approach, I would say. And then in the inpatient, but in the inpatient setting, like when we're talking about feet, we're talking about multiple teams taking care of patients. Where do you think other medical teams like can do a better job in terms of like thinking about feet?
After 8 years of working in the hospital, and I did do a lot of surgeries that did save people's lives, it stabilized them, it stopped their organs from shutting down because they're septic, or they have osteomyelitis, bone infection, or they have necrotizing fasciitis, gangrene. That needs to be removed, but that is only the beginning. I would talk to the patient on there are multiple factors that were missed in order for you to get to this point. I started noticing that patients thought that after I removed all of this necrotic tissue that they're done, it's over. And then I started noticing, well, you know what? It's my job to let them know this is just the beginning of your journey, because it was multiple things that were missed in order for it to occur to your foot. Really, it is. Like if you see me in the hospital, it really is like the last stage of something.
Mm-hmm.
So I tell them, like, you need to follow up with your vascular doctor if you have peripheral arterial disease. You need to follow up with your endocrinologist if your A1C is like 13. You have an ejection fracture of 15%. I have seen that. I was like, you got to follow up with your cardiologist. So we got to talk about diet and nutrition. We have to treat you entirely. I've even been bold enough to say, hey, let's talk to behavioral medicine. Because what is happening that these things are not occurring. But that took years to really see and understand that patients thought it was all done. And they would literally tell me that. They're like, but doc, like you took off the gangrene, it's gone. I was like, oh no. I just gave you a chance. That's all I did. I just stopped it from spreading. But now everything starts. The healing now starts.
Kind of going back to what you had said earlier, which was not just looking at the symptom and going back to the root cause and having that communication with the patient, in which we're talking about all these other events that transpired that led up to this event and then what the journey forward looks like. I think communication, absolutely, you're right, is the key, and really delving into detail and communication skills when we talk about what the patient is hearing and what we're seeing. Because as somebody, despite being a physician, when I was a patient, when doctors tell you said things when you're in a state of stress, sometimes they just don't make sense. And sometimes you might interpret them in a very wrong way.
And another interesting thing that I saw and noticed is like, I mean, you lose a foot, you lose a leg, you lose a toe, patients grieve. They grieve. Yes. They grieve really. It's hard and it's difficult. So I try my best to be empathetic with them and take my time. And was I the fastest doctor in the hospital? No, I wasn't. Were my notes done on time all the time? No, but I feel like I did the biggest part was to be with them and understand and hope that they understand what's going on. A lot of the time they would thank me for it. And I would emphasize, I am not a substitute for your endocrinologist. I am not a substitute for your vascular doctor. Okay. You still need to go to them. Just taking my time to explain it a little bit more because I do have some surface knowledge about this.
This is great because we have to recognize what a life altering event is when somebody goes through limb loss and amputations of any degree. That is definitely scarring, and then recognizing that and communicating that with the patient in a way that they can then make the next steps. I mean, just emphasizing all around for anyone listening right now, communicating in detail is the key here. Any other points that come to your mind when you think about, just in general, pearls you wish physicians knew? Because sometimes, and again, I go back and reminisce of the days when I was practicing full-time primary care, when you're in that flow, when we're dealing with multiple comorbid conditions for a patient, feet are very important. But for like chronic follow-up visits, unless there is a problem, a lot of times we don't have the patient take their shoes off and, take their socks off. And if you have 10, 15 minutes and it's not an annual physical, it's not that they have a complaint. What do you suggest for folks that are practicing in the traditional setting?
I would say with diabetics have a higher urgency with them, because I laugh at my diabetics and I say, you guys don't follow the rules. And they always laugh because it's like, you don't. There's always something going on that it misses my brain. So anything that they tell me, I'm on high alert. I think with at least for diabetics, ask them to take off their shoes, because I have saved people's toes from a diabetic foot ulcer and amputation. Because when the toes get contracted like this on diabetic, they put more pressure on the tip of the toe and they get a callus. That's called a pre-diabetic ulcer. That callus goes through the phalanx. And now basically we're amputated the whole entire toe, which changes the anatomy of the foot. But I could do something super simple, takes like less than 5 minutes, numb up the toe, do a flexor tenotomy and straighten it out. And now I rebalance that toe. And that saves so many diabetics from toe amputation. So if their toes are looking like this, and maybe they don't have callus or any tissue there, they eventually will. They'll eventually look at that buildup. So that'd be a good consultation to send. And it's pretty much a painless surgery. And they don't even need stitches. It heals up quickly. And there are multiple journals that talk about flexor tenotomies, helping diabetic prevent diabetic foot ulcers in toe amputations.
So take home point from that would be really, other than the diabetic foot exam that you might be doing for your patients, say if you can incorporate a practice in which they can remove their shoes, remove their socks, be their feet exposed. Is that something that you can tell your staff to have done by the time you go in, kind of like taking vitals, so that you have a more comprehensive assessment of the patient? I know I say this and I say it with compassion for all the physicians that are practicing in busy practices. And Cynthia, I do want to acknowledge the comment that you made earlier, that were you the fastest podiatrist on service? Were you the fastest and most productive one? Maybe not. But also kudos to you for creating a practice that you can now practice at your own pace, take your time with the patients. I know that took courage. So I do appreciate you sharing that. As we kind of wrap up for today, what are take-home points, anything you want to leave the audience with?
Well, like you said, it did take a lot of courage to open up my clinic, which is New Horizon Podiatry and Wellness in Orlando, Florida. Another take-home point with our Floridians, they do get a lot of tinea pedis, which is athlete's foot. And sometimes it can be easily prevented just from an antiperspirant spray, because the sweat on the foot itself is creating this mix of bacteria and fungus. So they get this itchy, dry skin. So just something as simple as changing your socks and antiperspirant spray can help prevent that. And if anybody is, interested in talking to me more about their podiatric foot and ankle health, they can find me on New Horizon podiatry.com. And my phone number is there, which is 407-259-4817. Can you get me? Talk to me.
So so whoever's interested will get to talk to you directly, which is huge. There's no middleman. That's wonderful. Thank you so much for taking the time and talking about foot care with us today. We don't often think about the feet enough. They're an important part. Like you said, they are the foundation. We need to think more holistically, more broadly, see how we can create spaces for our patients to have their complaints addressed, have their chronic foot pain addressed. And thank you so much for your time today.
Thank you, Amna. My first time on a podcast. I'm honored by you.
Thanks for listening. So please share it or like it or comment on a social media post or write us a 5-star review. Thank us again for listening to The Physician's Guide to Doctoring.